Welcome to the MamasteFit Podcast. In this episode, we're going to be talking about pushing mechanics. So what type of biomechanical movement patterns help to create more space in the bottom of the pelvis to help make it easier for your baby to come out while you're pushing. Welcome to the MamasteFit Podcast. This is Gina, perinatal fitness trainer and birth doula.
And I'm Roxanne, labor and delivery nurse and student midwife.
And this is the MamasteFit Podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable, because pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experience as mothers navigating this stage in our lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We're glad to have you with us on this journey and that you have chosen us to support you. Welcome to the MamasteFit Podcast. In this episode, we're going to be talking all about what type of movements and positions that you can do when you're pushing to create more space in the bottom of your pelvis. And so while some of these movement patterns are not creating like inches or feet of space, even millimeters matter when it comes to our big old baby heads. And while baby's head is molding and changing shape as it's moving through your pelvis, it can be really beneficial to also incorporate and increase the space in the pelvis as you are pushing. So there's a number of positions that help you create more space in the pelvic outlet. So the pelvic outlet is the bottom of the pelvis. And the main movement pattern that's going to create more space in the bottom of the pelvis is going to be internal rotation of the femurs, or a knees in, ankles out type position. When we find more internal rotation at the hip, it spreads the sits bones or the ischial tuberosities, where if you sit on your hands, you will feel these two bones. And when you're sitting down, those are kind of the bones that are pressing against your seat. When we find more internal rotation at the hip, these two bones are going to move further apart from one another. And if you're like, this is fake, I don't believe this, sit on your hands and try it yourself. So you can sit on your hands. Obviously, if you're driving, don't sit on your hands. Just imagine.
Unless you're at a red light.
Unless you're at a red light,
try it at the red light or stop sign.
So sit on your hands so that you can feel those ischial tuberosities or those sits bones. So they're the two like bumps on the bottom of your butt. And then you're going to bring your knees together and then let your ankles come further out. And you're going to feel those two bones move further apart. And then I want you to bring your ankles together and spread your knees really wide. And you're going to feel those bones move closer together. And so that right there should be enough of a clue for you to understand how your hip mechanics helps to influence your pelvic space. So how your hip is moving is going to determine how much space you can create in the bottom of your pelvis. And it's also important to know that there is no one movement that opens the entire pelvis. So when you're pushing and somebody's like, spread your knees really wide to make space for your baby, my next question will be, where are we creating space for baby? Really wide knees with external rotation tends to create more space in the top of the pelvis, but it can decrease space in the bottom of the pelvis. And so if you're being coached to really spread your knees really wide, maybe do not. Just go whatever is really comfortable for you, but typically more internal rotation or knees and ankles out is going to create more space in the bottom of the pelvis. So Roxanne, in your experience as a labor and delivery nurse supporting people as they push their babies out, can you feel a difference when someone finds wider knee positions versus internal rotation if you're helping with pushing at all, or not really?
So back when I did more internal support and coaching with pushing pre-MamasteFit, they would call them forceps fingers. So when you're giving internal feedback, you're pressing on these bones that are inside of the pelvis to open the outlet of the pelvis a little bit more to create more space for baby. Was I actually making any more space in reality while I press on the bones inside of the pelvis to make more space? Who knows if it actually moved or not, but it allowed a baby to come through the times that I did it. So I'm going to tell myself that I created millimeters of space by helping a baby come through, and it gave them more room to finish the rotation and be born. But I never had anybody attempt internal rotation when I was doing internal feedback, because most of the time it is a little bit harder to do internal feedback when someone is in internal rotation, because when they do go to internal rotation, they do close off like the area that you would normally be sitting. And it's just not as comfortable for me to like maneuver myself underneath their legs. So I've never really had to do internal support when someone also intuitively goes into internal rotation. But with my labor and delivery experience, if someone came in unmedicated, and even some people where their epidurals were not super dense, they would intuitively they would try to bring their knees together. And at the time, we're like, no, like you're going to like squish the head of your provider who was right there with your knees. Like, please just open your knees a little bit wider. But they would intuitively want to close their knees together and their feet out as their baby is finishing that rotation and starting to crown and come out. And at the time, like, you're like, hey, like, stop doing that. Like, what are you doing? You're making less space for your baby. But now I know they were not. They were intuitively making more space for their baby, and we were wrong, which I admit.
Yeah. It's about learning and growing.
Nobody's perfect. Nobody knows everything except for Gina.
I don't know everything either. But that's a big thing. Intuitive movement throughout your entire labor and your pushing phase is really important because you're going to tweak your positioning of your hips, of your body to create more space for your baby throughout your entire labor to include pushing. And so while we're telling you, the position that's going to create the most space for your baby is a more internally rotated position out of your hip where your knees are in and your ankles out. And just keep in mind, your knees do not need to be touching. They can still be wide, but the ankles just got to be a little bit further out for that internal rotation. So what we're not saying is if you are pushing, force yourself into this position because you may intuitively find a position that feels really good for you. And so you can find internal rotation in numerous pushing positions. You can be on your back if that feels most comfortable for you. You can be sideline, you can be in all fours, you can be standing. And so you can be in any position to find more of that internal rotation. If you follow our Instagram, we have videos where we have like little white dots on our butt. And when we spread our feet out and keep our knees in, you'll see that those white dots move further apart from one another. And so some folks get confused and they think the only position that you can find internal rotation is all fours, but you can find it on your back, on your side, standing, whatever position feels really good for you. So in addition to finding more internal hip rotation to create more space side to side in the bottom of the pelvis, we also want to think about where the sacrum is going. And so the first thing that we can do to allow the sacrum to more freely move backwards or the tailbone to move backwards so there's more space front to back in the pelvic outlet is to just not be flat on your back. So if you're flat on your back, either on the bed or on the floor, most people are not going to be delivering on the floor. But if you are flat on your back, it could decrease the range of motion of your sacrum. It could make it a little bit harder for your sacrum to move out of the way or the tailbone to move out of the way for your baby. And so if you are finding that being flat on your back is the most comfortable position for you, which it can be for some folks, they might feel most powerful in a supine position. For me, I was in kind of like a pseudo supine sideline position with both my home births. And it was because I felt very overwhelmed by my pushing phase and I just wanted to be in a more restorative position, and laying down was it for me. And so
I also laid down for my first.
And so it's okay if a supine or being on your back position feels best for you while you're pushing. But what we do want to be mindful of is making sure that we're still creating space for that sacrum. So it could just be slightly tilting, putting a pillow along your spine so that you're just slightly tilted. If you're pushing in a labor bed in the hospital, having your hips be in kind of the little cutout portion of the bed can be a good option. So it's not just doing things to slightly tilt your hips a little so there's a little bit of space for that sacrum. And you don't need feet, you don't need inches, we just need a little bit of movement capability. So try not to be completely flat on your back. If being in a supine position feels really good for you, just slightly tilt can be super beneficial.
Another thing that we want to think about with pushing is that we are in somewhat of an upright position if possible, because gravity is our friend. Baby is not coming straight through the pelvis where there's like your pelvis and it's a straight hole where they just come straight down and there's your baby. They are making a curve as they're coming out. So if you're laying flat on your back in a supine position, your baby has to work against gravity to kind of make that turn at the end almost and come out. But if we are in like upright type of position, and again, it doesn't have to be like you are literally standing in the bed or standing at the side, kind of upright, just elevating the head of the bed if you're in the bed to allow it to be where your head is above your butt, where that baby, again, is not working against gravity to make that final turn to come out. And you can do this in the bed, lying flat on your back. You could do it hands and knees. With hands and knees, you will want to elevate the bed because usually once we're in hands and knees, your head is still level with your butt. But elevating your shoulders up by lifting the head of the bed up can be really beneficial to be in that more upright position. You can be side lying. Again, elevate the bed so that you're in that upright side lying position, which is what Gina had me do, even though I didn't want to. She knows, she knew I needed to, but in the moment, you don't want to move. Another great one is the squat bar because you can hold on to the squat bar as you're in an upright position. The only caveat with the squat bar that I will put is that you are kind of in a supported squat. So there isn't a ton of like tension. Like you're not like holding a squat in your legs while you're in that pushing position. Just because that can put like that's a lot of energy in your legs to hold a deep squat or just a squat in general as you're pushing. But if you're supported, this can decrease the amount of tension you're holding and potentially decrease that risk of tear because deep squats when you're pushing, like holding a deep squat increases that tension on your perineum and can increase your likelihood of having a tear. Even with like a birth stool, if you're sitting on a birth stool or using the squat bars, if you're in a hospital, can be a really great upright position that your baby is allowing gravity to help them.
So in all of these upright positions, the sacrum can freely move wherever it needs to because it's just against like air. So there's nothing restricting its movement. Just air. But another thing that we can do to help influence the sacral movement is lat tension. So your lats are not attached to your sacrum, but they're attached to a bunch of fascia and different ligaments and tissues that attach to your sacrum. And so they can influence the sacral position. And so we have a lot of lat tension or your back muscles are turning on a lot. It helps to pull the bottom of the sacrum backwards. So it pulls that tailbone area back, which can create more space from front to back. And so this is why an intuitive movement during pushing tends to be pulling on things. So you might see like the videos on Instagram where somebody's like holding on to something hanging from the ceiling, like a sheet or a rope or something, or they're holding onto their legs, or typically when someone's pushing, they're pulling on something. And what that is doing is that's activating their lat musculature. And so the key to activate the lats, though, is we want to keep the elbows more in as opposed to flaring them out like chicken wings. Chicken wings is going to activate more of like your shoulder area, which is not going to influence the sacral position. So we want to think more like elbows in. If you're holding on to like the bed rails or things on the bed, think palms up. That tends to activate the lats a little bit more. And then think pull to yourself, not yourself towards whatever it is that you're hanging on to. So we're not curling our body towards our legs or our scarf. We're thinking like pull my legs to me, pull the scarf to me, pull the rope to me, or whatever it is that you're hanging on to. And this can help engage your lat musculature, which can influence your sacral position in a positive way to open the pelvic outlet. So the two main movements that are going to create more space in the bottom of your pelvis or the pelvic outlet is going to be internal hip rotation, so more knees in, ankles out, and then lat tension, which is going to help to influence the sacral position, but also just having there be space for the sacrum to move. So if you're not wanting to hold on to anything, you're just kind of hanging on for dear life, just try not to be flat on your back, and we're going to create some space for that sacrum. Your baby's going to have an easier time pushing it out of the way as they're trying to be born. So while we were telling you different things that you can do to create more space in the bottom of the pelvis, it's also important to acknowledge what the common pushing cues can be in a hospital setting. Typically, you're told to spread your knees really wide to make space for the baby. And now, while this is actually decreasing space in the pelvic outlet, if you look at it externally, you would probably think if I spread my knees wide, there's probably more space for my baby. It's easier for everyone to see, kind of like how Roxanne was talking about before. It's easier for your nurse or your provider to kind of get up in there, help you out as needed. And so wide knees tends to be more convenient for that, but the downside is decreasing space in the pelvic outlet. And so what you can do if you're like, hey, I want to integrate these pushing mechanics into my pushing positions to make my pushing more effective, to create more space for my baby. But if you're meeting any sort of resistance or you're unsure, like we're going to go over some tips to help you get into the position that you feel most comfortable in. So Roxanne, if somebody wants to push in whatever position, what are some tips that you have for them that they can do during their prenatal appointments, when they check in, and then if they're in the midst of pushing?
One thing would be prenatal appointments, bringing it up during your prenatal appointments for either going over your birth plan or just asking them like, what positions do you typically push in? Do you have like a preferred position? Like, what if I want to push on my side? Are you open to it? Hands and knees? Like, do people deliver standing up? Like, asking these questions during your prenatal appointments can be helpful because that kind of sets the expectation of whether or not there are going to be any pushback when you're actually in labor. If they're like, yeah, you can deliver in the shower if you really wanted to, they're probably going to be a little bit more open with the positions that you're pushing in. If you're like, no, you must be in your bed and particularly on your back, then you know that they may not be as open and it might be a little bit more of a fight. Or it might be time to find a new provider if you're wanting to do different positions during pushing.
Something that I have heard of when somebody is like bringing up like what positions can I push in is they'll be told you can push in whatever position that you want. But when it comes time for the baby to be born, you have to be on your back. So that's also something to like be clear about is, can I deliver and can my baby be birthed in any position? Or is there a specific position once the provider comes in that I have to be in? So that can be a great clarifying question to ask at prenatal appointments as well.
Then the next time you want to bring it up is when you check in at triage, whether it is an induction or you're in spontaneous labor, having a birth plan and giving it to that triage nurse so that they're aware of like, one, all of the birth options that you're wanting, if you want an IV, if you want intermittent monitoring, all of those things. But also when it gets to like the pushing portion of your birth plan, you know that, hey, I would like to push in different positions, like try different positions, like, you know, how is this going to work if I wanted to push in any position other than on my back? And that could be a good time to, one, make sure that if you only saw like a few providers during your prenatal appointments and the provider that's on that day is not one that you are familiar with, this would be a great time for them to be like, oh yes, I also support that you can push and deliver in any position that you want to. And then you know you don't really have to fight. But when it comes to actually pushing, it's really up to you. Like you can start pushing wherever you are. You can start pushing on your back and then you can move. We normally recommend moving a little bit during the pushing phase, especially if like it seems that baby is needing a little bit of help finishing the rotation. And like maybe if they're crowning for 9 years, like my daughter was, doing some positions during pushing can be beneficial. But it's really whatever your intuition is telling you to do is the best position. So if you're needing assistance, that would be the time that us as your medical team, healthcare providers, or doula would chime in, be like, hey, maybe let's try a lunge, or let's try on our side, or maybe let's try hands and knees. And that's when it would be helpful if you're wanting some help. But in the time, if you find a position that's comfortable for you, the hardest part is if your provider then comes in and they're like, okay, I know this position's really working for you, but for my comfort, I'm going to need you to get onto your back so that I can deliver your baby. That's probably the time when you're not you, unless like you're by yourself, your support team can then chime in to be like, hey, are you really comfortable in this position? And then you say yes or no. Hey, I think she's good, or okay, we can try a new position at this time, depending on your answer, because no one's going to like put their hands on you and forcibly put you on your back, because that's assault. If you just say, no, I'm comfortable in the position that I'm in, I would like to continue pushing here and deliver in this position, the worst that they can do is like, okay, well, I'll just stand here and maybe someone will catch your baby. Then you can catch your own baby.
So that's usually the technique that I use as a doula if I'm supporting a birth and somebody is really comfortable in a position that is not flat on their back. I'll just simply ask them out loud, are you comfortable in this position? If somebody is bringing up a position change, like a nurse is saying, hey, I need you to get on your back, the provider's coming in, or the provider says, okay, get her on her back. I'll say, hey, like, are you comfortable in the position that you're in right now? And if they say yes, I'm like, she's comfortable in this position. And then that's kind of the end of the conversation. And I'm like, nobody's going to put hands on you and put you into a different position. Or the other thing that usually happens is they're like, I literally don't care. Just get this baby out of me. And they're just going to go wherever is going to make things happen. So it can really go either way in that moment. But if you are comfortable in the position that you are in, having your team ready to advocate for you to stay in the position that you are, or unfortunately, pushing is not the time that you need to be or that you should be advocating for yourself. Like that's a really vulnerable time. But worst case, if you need to, you can also say, I'm good. I'm not moving. And then people are going to have to figure it out. So those are some scenarios that like I would consider when it comes to pushing. Like you don't really know what it's going to be like in the moment.
Like having a conversation with your nurse, like prior to pushing, can really be beneficial, because me as the nurse, that is my job, is to advocate for what you're wanting in your birth. And so if I know you are really wanting to push on your side, as soon as a provider will walk into that room for the delivery, I say she would really like to push on her side and deliver her baby on her side. And then they know. And if at that time they're like, oh, well, I prefer her to push on her back, then I say, well, she would really like to push on her side. And then they usually don't have a response to that. I think there are some like horror stories out there of like the provider being like, okay, well, like I'm just going to stand over here and you can deliver your own baby, or like, okay, well, I'll come back when you're ready to get on your back. But I feel like hopefully most providers are like, okay, well, we'll figure this out.
I can't say I've actually come into that scenario. I don't want to say that it's never happened, but as a doula, like I haven't had a provider that's like, I'm not going to do this. Like, goodbye.
But then your nurse is there, so like catch your baby.
Somebody will catch the baby. You can catch your own baby also. But this is why prenatally it's really important to have a clear understanding of how different things are handled during your birth, what you can expect during your birth, and then you can make a decision whether or not that vibes with you, or whether or not you need to hire somebody to help advocate for you, or you need to make sure that you have additional support people there to help advocate for you in the moment, because maybe you don't have another option. This is the only hospital available to you. And so the option to switch providers is not always available. So if you decide that this is not the vibe you're liking, find a new provider, find a new clinic, maybe explore out-of-hospital births, like maybe you have to travel somewhere else. But if you don't have another option, or you're not willing to travel further, which is totally valid, like I don't want to drive 2 hours to a hospital to give birth.
1 hour was my limit.
Like I'm just going to stay at my house. But like, and then hours is probably my max too. But if you aren't going to be able to switch your birth location and you're not confident on the birth vibe matching what you're looking for, making sure that you have support people there available for you. So your partner, usually an additional support person, either like another family member, a friend, if you can afford it, a doula. And there are some doulas that offer like free or even sliding scale services as well. There are some like newer doulas that offer their services at a lower rate. And so it's kind of like a trade-off where you get a discounted doula while they get some experience, but they do have training. They're not just like coming off the street, hopefully.
Just grab a random person
just grab a random person and call them a doula. But having an additional support person can be really beneficial if you feel like you're potentially looking at a fight going in. But I will say the majority of the hospitals that I support births in, the providers are like, whatever position you want to be in, like go for it. And even in the hospital where there is a little bit more resistance, I find that most of the providers really don't care that much. They're like, whatever position she wants to be in is fine with me. And so again, I haven't found it to be like a huge issue, but it can become one. And it's being in the middle of pushing is not a great time to have to advocate for yourself.
No, it's a very stressful time already.
Yeah.
You don't want to add it additional.
Being clear prenatally can be super beneficial. Being clear when you check in, hoping that your nurse is ready to advocate for you as needed, and then having your support team ready to advocate if needed. But hopefully you just show up, you go into whatever position feels really good for you, and your baby just falls out of your body.
Yeah.
We can only hope for that. Let's take a break from this week's episode to talk about our sponsor, Needed. Needed just came out with their new omega-3, which one, we need omega to help with our brain, our heart, and our hormone development for both us and for our baby. So while we're pregnant, it's really important that we're taking in some sort of omega-3. In addition, their omega-3 does not have a fishy aftertaste, which for me, anytime I took an omega-3 and I burped, it was like fish in my mouth.
Oh, yeah.
It was not pleasant. I did not like it. But this omega-3, if you burp, there's no fish taste, which I am like, finally.
So I'm not sure how it works and why when you burp, it does not taste like fish, but when you smell it out of the bottle, it does smell fishy. So it is like good omega-3. It does not taste fishy when you take the capsules, and then it also doesn't give that burp, which I don't understand it. but it also has a high level of both the DHA and the EPA. So if you take all 4 capsules, you get 1,000 milligrams of both the DHA and the EPA. Their other omega-3 is still good, but it is 400 milligrams of DHA and only 100 milligrams of EPA, and that's with 2 capsules. So you do have to take 4 capsules of this omega-3 to get those levels, but the fact that it is available, it's in a capsule form, and it doesn't give you the fish burp taste is amazing. It's also shelf stable, so you do not have to keep it in your fridge, which a lot of people, it was hard to keep mine in my fridge, or they would like stick together if I accidentally left them out. This doesn't happen. Like I guess you can put it in your fridge if you really want to, but you don't have to. It's perfectly safe on your cabinets. With everything supplements, you also always want to get your levels tested before you start supplementing, because not all of us maybe need to supplement that much omega-3. So Needed does have an omega-3 nutrient testing kit that you can order to determine how much omega-3 you should be actually taking. Like maybe you only need to take 2 capsules versus all 4, or maybe you need to take all 4. Can be really beneficial. So you can check out their new omega-3 as well as their omega-3 testing kit at thisisneeded.com, and you can use our code MamastePod for 20% off your first order or the first 3 months of your subscription, which who doesn't like things to just show up without you having to remember to order them? I do.
So in addition to creating more space in the bottom of the pelvis, there is some stuff prenatally that you can do to help facilitate this opening of the space as well. So you don't have to wait till birth to try to figure out how to open your pelvis. And this is a huge component of the MamasteFit prenatal fitness program, is being able to create space in the bottom of your pelvis, the middle of your pelvis, the top of your pelvis. We incorporate all of these pelvic opening exercises because we don't want to wait till birth to figure out that we have some movement restrictions or we have some pelvic floor tension. So the first thing that we want to think about, again, is creating more space side to side in the bottom of the pelvis, which is going to be that internal rotation at the hip. And the key muscles that are going to help you find more internal rotation are your hamstrings, which are the muscles on the back of your thighs, and your adductors, which are your inner thigh musculature. So those 2 muscles help, or I guess there's a bunch of muscles with them. Those 2 muscle groups help to pull your hips into internal rotation. So focusing on strengthening exercises that help to strengthen the hamstrings and the inner thighs can be super beneficial. So any sort of like hinge type exercise like deadlifts, single leg deadlifts, stagger stance, Romanian deadlifts, poor man's leg curls. There's so many hamstring focused exercises that can help strengthen the hamstrings, which help pull your pelvis into that internal rotation. In addition, we can strengthen the adductor muscles, which during pregnancy tend to get longer and a little bit more length as we favor more external rotation. So strengthening the inner thighs can be beneficial. You can start with even just squeezing a ball between your thighs. You can go all the way to Copenhagen planks. Even hamstring strengthening exercises help to target the inner thighs as well. You can use like resistance bands to target the adductors. And so there's a lot of exercises that you can do to also help strengthen the inner thigh musculature.
So one of my favorite tricks for adductors and abductors, because some people are like, I don't know what you mean when you say adductors and abductors, is when you are adding to something, you're like squeezing your knees together, like coming together, like you're adding your knees together, adduction. When someone gets abducted, they're being taken away. It's kind of a scary word, but like when you're abducting, like aliens abduct you, they're taking you away. So your knees are being taken away is my abduction, adduction, bringing them together. So for people, when you're trying to do adductions, bring your knees together, some sort of bringing the knees together.
I was just thinking adding your legs together, but I had nothing for abduction, so that's good. You're being abducted.
Your knees are being abducted.
So with adduction, we're thinking legs are coming closer together, and that helps to strengthen the inner thigh musculature. And so the inner thighs and the hamstrings help to pull the pelvis into that internal rotation. So incorporating those types of exercises can be really beneficial throughout your prenatal programming, and we already do that for you in the MamasteFit prenatal fitness programming.
Use Story 10 for 10% off.
Story 10% off. So if you are just like, I don't want to figure this out myself, well, we already figured it out for you. Just join our online fitness programs. The other muscle that's really important to help pull the pelvis into more opening, so help pull that sacrum into more opening for the bottom of the pelvis, is going to be the lat musculature. So back strengthening exercises like bent over rows, single arm rows, banded rows, anything where you're rowing is going to help to strengthen the lats. And then to combine them both, because I like to save time, we can do like a deadlift with banded row. So we have our hamstring strengthening exercise with our lat strengthening exercise. A staggered stance, Romanian deadlift with banded row. We got some of that inter-rotation. We got our banded row. So we can incorporate our hinge focus exercises with a banded row to kind of do a 2-for-1. So we're strengthening the hamstrings and adductors, and we're strengthening the lats to create all that space in the bottom of the pelvis. One of the things that we love to use in our gym to help with the banded exercise is the crossover symmetry.
For those that are watching the YouTube video, these are the crossover symmetry bands.
So these are the crossover symmetry bands. They have 3 different attachments. So you can attach it to a door anchor. So it's just a strap that you put around your door. It's really versatile, makes it super easy to attach the bands to something. You can do a wall mount where you attach it to like a stud in your wall. Like don't just attach it to drywall, obviously.
It will pull out.
It'll pull out. Attach it to a stud in your wall. Or they have squat rack attachments. So if you have a power rack like we do here in the gym, you can attach it to the power rack. All of the bands have handles. They're different colors for different weights. And so when we're doing our banded rows, we'll just use one of the bands and we'll row with that as we do our single leg deadlift, our stagger stance, Romanian deadlift, our straight leg deadlift with banded row. And so this makes it really easy for us to do those exercises. And because they attach, it's really nice. They also have like a hip core band, which is like a really thick glute band, which is super nice because it doesn't roll around as you do your abduction or your kidnapping exercises.
I don't know if I'd say kidnapping. We're all adults here.
Your adult napping exercises. So that can be a really great tool to incorporate into your toolkit, your gym kit. We love crossover symmetry. If you want to check them out, you can use code MamasteFit to get 20% off your system. They have tons of sales throughout the year as well, so sign up for their newsletter so you get notified whenever they have sales. We usually post about them on our Instagram. Our gym is completely outfitted in crossover symmetry because we love them so much. And if you want to check them out, go check them out at their website, crossoversymmetry.com. And again, use code MamasteFit to get 20% off. So again, we don't have to wait till birth to figure out, can I open my pelvis? We can do a whole bunch of stuff during pregnancy, and we do that all for you with the MamasteFit prenatal fitness programs. Our programs are in the Team Builder app, which is just like a list of exercise, so it's a traditional delivery of workout format. So it's a list of exercises with demo videos. You can input your weights and your progress, or they're on-demand videos, so full-length workout videos that you follow at the same time. So we have those 2 options. You can check them out on our website and explore different options to figure out which one's the best for you. But again, we don't have to wait till birth to figure out how to open our pelvis. We can do that prenatally. And if you want to focus on opening the pelvic outlet, we want to think about strengthening the hamstrings and the inner thighs. So lots of deadlifts, hinge focus exercises where we're squeezing the legs together, either like a ball, that like machine where you're bringing the legs together, or even doing like Copenhagen planks can be a great option. And then to help strengthen the lats, we want to focus on rowing type motions. So bent over row, single arm rows. And then we can combine them together with like a staggered stance, RDL, and banded row. And we'll link some examples of exercises as well down in the show notes so that you can have like more of a visual of what we're talking about. But you can incorporate those all into your prenatal fitness programming to help you prepare for pushing. So just to recap everything that we discussed in this episode, when we want to create more space in the bottom of the pelvis, we're typically creating more space while we're pushing to have more space for our baby to come out of our body. They got these big old heads. And while their heads are molding and changing shape to come through our pelvis, we can create more space with different movement patterns. We're going to create more space side to side in the bottom of the pelvis or the pelvic outlet with interrotation at the hip. So knees in, ankles out. Again, knees don't have to be touching. They can still be wide, but we just want the ankles to be a little bit further out. And this is going to help to create that interrotation to create more space side to side. During pregnancy, you can focus on exercises that target the hamstrings and the inner thighs to help prep you to be able to create that space in the bottom of your pelvis. In addition, we want to create space front to back in the bottom of the pelvis by ensuring that the sacrum can freely move. So we want that tailbone or the bottom of the sacrum to be able to move backwards. And we can do that by ensuring there's one space for the sacrum to move. So ideally not being flat on our back, being slightly tilted, sideline, or even better, upright pushing positions if they are comfortable for you. Because the best pushing position is the one that you choose to do. And during pregnancy, we can focus on strengthening the lat musculature because the lat tension can help to influence the sacral position by pulling that tailbone backwards. And so focusing on like rowing type exercises during pregnancy can be beneficial. And then during labor, focusing on pulling towards yourself with the elbows a little bit more in can help activate the lats to influence the sacral position.
And knowing that you can push in whatever position that you want to, as long as you choose to push in that position. When you're advocating for wanting to push in those positions, it's helpful to bring it up during your prenatal appointments to, one, get a feel for how open your providers are, but also having someone to advocate for you. One, when you first check in at the hospital, and then when you are actually pushing, they're advocating to be like, hey, are you comfortable in this position? She would like to stay in this position for pushing and delivery. And then just like Gina's little tip, asking, can I push in this position and deliver in this position? Because sometimes they'll let you push in whatever position, but when you're actually delivering the baby, they'll want you on your back.
So thank you so much for listening to this episode. If you want more from us, you can join our online prenatal fitness programs. Again, we show you all the exercises to do to help create space in all the levels of your pelvis to help you prepare for birth, for pushing, and we even have programs postpartum. So if you're postpartum, you can join our postpartum fitness programs. During pregnancy, we also offer our childbirth education course, which is all online, self-paced. You have lifetime of the course access. So use it for this pregnancy, review it for future pregnancies. You can't share it with your friends, but I guess we wouldn't know if you did. We also have our pelvic floor prep for birth course, which is a bunch of pelvic floor release exercises that you can do. And we go way more than just deep squats and butterfly poses. We're talking about different hip shifting movements, how your rib cage position influence your pelvic floor tension. And so there's a lot of exercises in that course as well to help you prepare for your birth. If you're postpartum, we have our postpartum fitness courses to help you return to fitness after birth. We incorporate rehabilitation and recovery from birth, and then that return to lifting or whatever your sport is. We have a return to running program, Olympic weightlifting, and then we have a program that's specific to our first responders and military service members as well. In addition to your postpartum fitness programs, we also have our postpartum education course that includes infant CPR and infant massage.
Both those courses are taught by an American Heart Association instructor as well as a licensed massage therapist.
And then if you're a professional and you're wanting to earn CEUs and learn more from us, we have our birth worker education course in addition to our pre- and postnatal fitness trainer course. You can check out all of our courses on our website at MamasteFit.com, and you can use code STORY10 to get 10% off everything that's online.
Check it out.
Thank you so much for listening to this episode. If you enjoyed it, be sure you subscribe to our channel so you get notified whenever we release new episodes. We release new episodes every Wednesday and new birth stories every Friday.
This podcast is sponsored by Needed, a nutrition company that focuses on the perinatal timeframe, and you can use our code MamastePod for 20% off your first order or the first 3 months of your subscription.
This podcast is also sponsored by Crossover Symmetry, where we have all of our shoulder bands and hip core bands from. We love their equipment, and if you want to check them out, you can check them out at crossoversymmetry.com and use code MamasteFit to get 20% off your order.